Here we are waiting to talk to our doctor for the results of our MRI.
Ready.
Go for it.
All right. So they go over here's of course the report, and the MRI gives us different densities of different structures in the body. So fluid appears differently than appears solid structures like muscle, bone, tendon, and so on, which again appear different from each other even. So they go over each structure in the area of interest. In your case, we did the MRI of the pelvis. So they go over the bones, of course. Obviously, you don't have any fractures. You don't have any problems with the joint itself, the hip joints inside. They go over the muscles and tendons and the soft tissues. So they go over the major tendons in that area. So your glute tendons are intact. That's fine. We kind of expected that. Your one of your hip flexor muscles is fine. I said not one of them, but one of the two that is visible in this MRI is fine. And then your sciatic nerve and the piriformis, which is one of your external rotators, is fine.
Appears unremarkable.
Exactly. That's good.
Right.
You want no news.
Right.
And then the area of question that we are getting the MRI for is the hamstring, obviously, because of your injury. So the common hamstring origin. So out of your hamstring tendons, they all start from this like one giant bundle, basically, where it attaches to the pelvis, kind of where you sit, that bony area.
The triangle.
Exactly.
I think of it as a triangle because it peaks into a triangle.
Mm-hmm.
So
it's right behind that area.
Right.
Yep. And oops, go backwards there. So in that common hamstring origin where they all sprout from, kind of like a tree trunk sprouting into roots, there is a tear at that origin with obviously swelling and bruising around it, and there's a retraction of 2 centimeters. So that means that the tendon where it had torn is now retracted like a rubber band. If you cut it, when it's tensioned, it pulls back 2 centimeters, which is not nothing, but it's significant. Yeah, it's significant. And obviously you're feeling that as well. The rest of it is okay. The spine, of course, is fine in your low back. Your pelvic organs are okay. And then they give a summary right here at the bottom of the positive findings, which again is what we just discussed with the hamstring origin tear with that retraction of 2 centimeters. So after I looked at your results, I contacted Dr. He's one of the sports med guys who addresses these surgically if need be. And I had him take a look at your MRI and the images and stuff. And I'm not going to speak for him and say you need surgery, but he said he is definitely willing to see you to discuss if surgery would be the right option and is appropriate in your particular case to basically pull that string back. Exactly. Yep.
So it doesn't tear further or get worse.
Yeah, well, just so it can heal.
Right.
Because it stands now with that gap. It will never come back to where it's supposed to be.
Right.
Without some sort of intervention. And maybe you don't need it. Not my decision to make. But if it does, it will definitely need that because it will not heal in the right spot.
And if I want to properly function again, I think it's wise to.
Definitely.
Because I do exercise 5 times a week, so I definitely would move forward.
Absolutely. Understood. What are the questions?
Well, there you have it, folks. You heard it from the doctor's mouth. So, we are going to see another orthopedic who specializes in this type of tear. And then we're going to set up for surgery. Yay! Which it's okay with because I find surgeries interesting. Find me weird, but I love surgeries. I find them fascinating. Granted, I could never be a doctor, but I do love the human body, the human anatomy, and how incredible it actually is and how you can recover and you can heal and everything. So it's now the waiting game to see another doctor and then to set up surgery. So it's scheduled to see another doctor on September 30th. We're trying to bump that up because the longer you wait on this type of injury, the recovery process is a lot harder and surgery can become more difficult. Think of how did he explain it? So the longer you wait on this injury, it is harder to pull the muscle to the bone and suture it up. So it can be critical. So if you have ever experienced a hamstring tear, don't actually wait for surgery. Get on top of it so you can heal faster and recover faster. So there I am from here. At this point, we're just on the waiting game. Again, I will keep everyone posted and let you know how it goes.